Doctors, what's the weirdest case of someone self diagnosing and it being actually correct? I worked with an interventional radiologist, venous disease specialist, and we had a self referred patient who came to see us. She started off with, "Well, I've done lots of research on the internet," which is almost always a bad start. However, this lady was a competitive cyclist and complained of unilateral leg weakness during her rides. She was otherwise very healthy. She had cycled miles and miles every day for many years. Suddenly, she could barely finish a 5-mile ride. She had found online the diagnosis of external iliac artery endofibrosis, which is very, very rare but more common in lifelong cyclists because they are bending over at such an angle for such long periods of times that they're compressing their external iliac artery, causing scar tissue to build up and limit the flow. She asked my doctor to order her a CT scan because her other doctors would not. She was basically just complaining of being tired. But since we worked next door to a CT scanner, we said, sure. Turns out she was right. She was then referred on to a vascular surgeon and I assume made a wonderful recovery. One of our shorter consults actually, since it was so easy to rule in and out and she presented well-researched, compelling evidence. Well, I feel like of all self-diagnosed people, the athletes are definitely the ones you should be listening to. They know their body, they usually have some anatomical knowledge, and can interpret what they read on the web. Story 2. My attending had a patient with stomach pain, and although he looked and insisted that he felt fine, his wife was insisting something was very wrong and she pleaded with us to do some tests. So we did, not thinking we were going to find anything. Turns out the guy was in severe kidney failure due to his dehydration from the stomach pain. Youngish, healthy guy, by the way. We would have never run that test and sent the guy to the ER if his wife didn't suspect that something terrible was wrong. Story 3. Medical student here. Had a patient in her 20s who felt a lump in her chest area that she was concerned about. She had Googled it and figured it was a benign fibroadenoma since it grew cyclically with her menstrual cycle, but still wanted to check it out just to be safe. She turned out to be right, but she was wise to get it checked out, just in case she wasn't. Story 4. Not sure if this counts. When I was 25, 28, my family and I were planning on going on a snow vacation in then still Czechoslovakia before it split up, and woke up with a weird feeling in my stomach. No pain, just something being off. Went to my doctor, he felt around a bit, found nothing, and wanted to send me home. I refused and got a referral to the hospital. This was still all only because of my gut feeling, and had some tests done, had an echo. All tests came back negative. The surgeon eventually came by and we had a chat. Based on my words alone, not the results, he scheduled me for a laparoscopy to remove my appendix, stating it will have to come out at one point, might as well do it early. I went under and woke up with a new scar on my belly. Turns out my appendix was heavily inflamed when they went in. Because I had no pain from it, I would likely only have found out my appendix gave out on top of a snowy mountain nowhere near any doctors, when my stomach would have gone septic, so good chance of passing away. The surgeon couldn't stop talking about how I probably saved my own life by being so adamant something was wrong. Story 5. Medical student here. I was the patient and I diagnosed myself. I had this gnawing, dull pain on the ball of my foot for like almost 6 months, but during my surgery rotation, it got progressively worse since I was standing for most of the day. I couldn't even walk barefoot anymore. Had to wear padded flip-flops at home or custom orthotics insoles outside. My foot would hurt at the end of my runs, surprisingly not during my runs, when stretching my foot and when pushing on the ball of my foot. I told my primary doctor that I thought I had a sesamoid fracture because of my symptoms, risk factors, and duration of the pain. She didn't think so and told me to do RICE, rest, ice, compression, elevate, even though this had been going on for months. I said okay, but also asked for a sports medicine referral just in case I couldn't find time to come back to follow up with her if RICE didn't work. The sports med doctor took x-rays of both feet, saw that one of the sesamoid bones had completely fractured. In a walking boot now, and they're thinking of surgery if the pain doesn't get any better. Story 6. Not a doctor, but a friend showed up to my dorm room and asked to borrow some anti-itch cream for what he said was a spider bite. I told him that it was definitely not a spider bite and he should go to the doctor. He laughed and refused. I told him it might be MRSA and he should get it checked out. He kind of rolled his eyes but agreed to let someone look at it. It was MRSA. Story 7. An old roommate and friend of mine had a severely sore throat to the point that she was crying from the intensity of the pain. Now this is a girl with a crazy high pain tolerance. I was with her when she injured her leg and the most she did after the adrenaline wore off was mutter, "Damn, this sucks," while hobbling to the car on just some strong ibuprofen. But watching her cry and whimper while barely able to talk, swallow food, or breathe was enough for me to take her into urgent care. If the pain is that bad, something is definitely wrong. Well, I figured it was either a bad case of strep or tonsillitis. The frickin' doctor told her it's just GERD. and prescribes her medicine for acid reflux. We head home frustrated, but she's trying to convince herself that's all that she has. I Google her symptoms, and everything is pointing to strep. The next day, she's even worse. I take her to the ER this time because I'm scared she'll suffocate on her own swollen tonsils, and I can see her glands are swollen under her jaw. Finally got a swab test, and she comes out of the doctor's office a few hours later with this horrified look on her face. She was already dealing with severe strep infection, and on top of that, contracted an STD from her boyfriend. A strong round of antibiotics later, and she was back to her old self and happily single. Story 8. Finally, something I can answer. I had, for my entire life since adolescence, a lymph node at the top of my tailbone area that would sometimes become swollen and painful and would have trouble sitting down. It would persist for 2 to 3 days and then go back to normal. I looked it up when I was a freshman in college and came across the term pilonidal dimple, which is a genetic abnormality present at birth that, along with my symptoms of being prone to infection, causes extra hair to grow out of it, which was also a problem I had. I was absolutely convinced. I talked to my mom, a nurse about it, and then my GP, who I had been with my entire life, and they didn't think that's what it was, mainly because it's a condition diagnosed at birth. Fast forward to my sophomore year, the lymph node became swollen and the most painful it had ever been. I couldn't sleep. I went to the ER because it was 4 in the morning and told them I think this is the condition I have and the pain it's currently causing. They take me back, the doctor comes in, confirms it, drains the infection, excises the node. 6 years later, I have never had another problem with my lymph node pain, but I do still have problems with hair growing out of it. Story 9. Patient here. Both my brother and I had pyloric stenosis as infants. I came 7 years after my brother, so my mom knew exactly what it was. The doctor that she was dealing with didn't want to hospitalize me. I was projectile retching because they thought my mom was just a new mom who didn't know what she was doing. After the doctor told her to come back after the weekend, it was a Friday, I projectile retched on him there at the hospital. I ended up getting my surgery the same day. Story 10. My husband had severe chest pain, so bad he thought he was passing away, made him retch, and the only thing that helped was lidocaine in the emergency room. The surgeon who did his scope found he has a large hiatal hernia and referred him to a gastroenterologist for surgery to correct it. When they do surgery for a hiatal hernia, you can't ever burp or retch again. The gastrosurgeon talked with my husband for a little bit, asked him about his symptoms, and told him he thought it was his gallbladder. One ultrasound later, a swollen gallbladder packed with stones. They scheduled his surgery and took that bad boy out. The doc said the stomach area is stupid for nerves, meaning that's why a doctor can't tell what's wrong by where it hurts. There have to be other symptoms or clues. His gallbladder never hurt him, but it caused excruciating pain in his sternum. The doc said he had a female patient whose gallbladder pain manifested on the other side under her ribs, opposite the side of the gallbladder is on. Why don't they teach this to general doctors? Story 11. Not a doctor, but I work in pathology. I started to have pain in my back, and I got to the point I just couldn't stand straight. One day at work, and I was on the floor from the pain, went to the ER and told them I think it's my gallbladder. They told me nope, pulled muscle, sent me away. This kept happening, and I started a diary on what I was doing prior to each episode. Classic gallbladder stone symptoms. Back pain that radiates up, happens after eating fatty food, including meat, etc. I went to the ER, my personal doctor, 6 times, and each time I was told I was pregnant even though the test was negative each time. I kept insisting it was my gallbladder. Finally, I was so sick and crying at work after being discharged from the ER again, telling me that I'm pregnant and to get over it. When my pathologist, who specializes in gastric pathology, saw me, he took me back to the ER and made them give me a CT scan. Bingo, gallbladder was blocked. A month later, had surgery and had a lot of little gallstones. Story 12. Had arthroscopic knee surgery on a Wednesday morning, felt great Thursday, woke up Friday and had a little tightness in my chest but attributed it to having been intubated. Woke up Saturday and felt like an elephant was sitting on my chest. Walking 30 feet to my bathroom winded me as if I'd run a mile. I called the on-call surgeon and explained my symptoms. He brushed me off and said I shouldn't worry given my age and overall health. I was about 37 or 38. I hung up and immediately called my mom to come drive me to the hospital. I knew something was seriously wrong. They immediately did some tests and a chest CT. Within 20 minutes of getting to the ER, they diagnosed me with multiple bilateral pulmonary embolisms, clots in both my lungs. I could have passed away at a moment's notice. Wound up in the hospital for a week on a heparin drip and on Coumadin for like 6 months after. Story 13. Not a doctor, but I work at a vet office. I can't remember the exact symptoms, but an older lady had an older cat who was ADR, ain't doing right, and she was concerned it could possibly have mercury poisoning. Major eye rolls by the docs and staff, but we took red liquid and sent it off. She had been feeding this cat a can of tuna a day for the past 15 years. We get the result and ding ding ding, slight mercury poisoning. I don't even remember the treatment, but we were all stunned. One of the most memorable times Dr. Google was actually right. Story 14. I correctly diagnosed myself after seeing 3 doctors with a severe stomach ulcer. I had it for 8 months, lost 25 pounds, spent a crazy amount of money on copays and medications. One round of Prilosec cured it. I got it from an endoscopy I had done after a bout of food poisoning. They biopsied 2 sections of my stomach and it never healed. Cue stomach ulcer. Story 15. A guy was out mowing and his toddler was close by. The kid suddenly started screaming, and when dad went to calm him, he noticed a tiny nick on his back. He took him to the local doctor, who said it was probably just a rock thrown up by the mower that scraped the skin, because the kid seemed pretty calm and not too sore. The guy thought it was something more and so brought the kid to our larger hospital. When we did an abdominal x-ray, there was a segment of metal embedded in the kid's back. We then did a CT scan and the wire ran parallel to the abdominal cavity, went through one of the kidneys, and just nicked the largest vein in the body. It's hard to say how bad it would have been if it had been missed for much longer. If the wire had shifted, he may have passed away, or given that it was a wire that had been outside for a while, he may have ended up septic. Story 16. I told my internal medicine doctor for years I had Hashimoto's. I had all the symptoms, including the weird ones like hiccups, but nothing registered on tests. She basically called me an idiot and diagnosed me as bipolar. This went on for 10 years, and the medication I was prescribed for bipolar disorder seriously affected my mental health. Finally got old enough to realize I could tell her to screw off and find an endocrinologist. He did an ultrasound on my thyroid and said it was barely functioning. I had to get a biopsy to make sure I didn't have cancer. Years later, and I'm still dealing with it since there really isn't a way to treat all the symptoms. Medicine helps though. Bipolar medicine is out of my system, and that's probably the greatest win. My mental health vastly improved. Last year, my mother ran into my internal medicine doctor and she apologized to my mother. Turns out she didn't believe Hashimoto's was a real autoimmune disease until she also was diagnosed with it. Story 17. Not a doctor, but I was the one who self-diagnosed. I rolled my ankle outside my cousin's house and felt a quick pain in the side of my foot. I immediately knew I injured my foot. My cousin's husband drives me to the hospital where I tell the intake person I injured my 5th metatarsal. She laughs and says I can't possibly know the exact bone I broke or if it was in fact injured. I see the doctor before x-rays and he too laughs and tells me I'm most likely wrong. Well, fast forward to after my x-rays are looked at and the doctor walks into my room and goes, "Well, Dr. Staceface 1789, you were right, you did injure your 5th metatarsal." To which I responded, "I know, I injured my other 5th metatarsal exactly 1 year ago the same way." So the answer to your question is, I wear a size small boot and I'm 5'1", so the shortest crutches will do. Story 18. My mother diagnosed my appendicitis. I was 7 years old and had stomach pain radiating out from my right lower abdomen. I was retching for hours and dry heaving once I was dehydrated. We went to the doctor and he said it was some kind of flu thing, whatever that means, but agreed to keep me overnight for observation because of how dehydrated I was. 11 p.m. that night, I woke up screaming when my appendix had basically completely shut down. If I had been home, I wouldn't have survived. So 2 years later, when my brother was brought in with the same symptoms, my mother was not taking no for an answer. Story 19. Another one starting with not a doctor. I was a 14-year-old slightly overweight girl who told multiple doctors over multiple years that my legs hurt like I ran. They told me it was because I wasn't fit enough, see, slightly overweight. Then when I pointed out I was working on a horse farm and it was still happening, they said it was shin injuries. Never mind that no one actually examined my leg or sent me for x-rays. Finally, it gets to the point where I can't walk without this pain, not even 10 minutes to class, and any further has me crying and threatening to hurt my leg. The doctor finally refers me to a podiatrist to ask what the pain feels like. I say, it's like my shin bones being squeezed in a clamp and my legs feel heavy all the time. It takes him 5 seconds to refer me to a sports doctor who confirms that it's chronic exertional compartment syndrome and it needs surgery rather than management because it is bad. Now here's the kicker. The exam for chronic exertional compartment syndrome involves getting a needle stuck into your leg to measure pressure, once at rest and then once after you've exercised to flare the condition up. After reading the result at rest, the sports doctor cut the second part out of the exam and warned me to not flare the condition up until I'd had it operated on. While it is not usually a medical emergency, if you push through the pain once it's into while you walk territory, you can turn it into acute compartment syndrome, which is a surgical emergency. The doctors who had been telling me I wasn't fit enough, they were telling me to push through the pain and get over it. The doctor who ended up assisting on the operation on my legs 5 years later, the doctor who told me I was just unfit. Story 20. Not a doctor, but the patient. I went to a routine appointment where my pressure was 172 over 130. I'm 5'6", 115 pounds with a healthy lifestyle. Get told to go to the urgent care, take the elevator down, and present with 182 over 140, instantly sedated and then referred to a doctor. I did some research beforehand and found fibromuscular dysplasia, a rare disease. Go to my doctor's appointment, tell her what I think it is, and after 3 months of testing for other things, we do the test for it, and bingo, FMD. In her 21 years, my doctor had never seen a case, and she didn't outright disbelieve me, but had to rule out that it wasn't being caused by my lupus. Up until that initial appointment, I had been fine. I had some heart palpitations, but thought they were stress-related. Even went to the ER for them, and they released me saying they were nothing. Basically, thank God for the internet. Story 21. Recently had surgery, went for a follow-up a week later, and the doc says everything is fine. Wife says, that looks infected. Doc blows her off and says it's supposed to look like that. 2 days later, I'm lying in a hospital bed with doctors debating whether to remove my finger and possibly my hand. My finger was severely infected. After 7 days in the hospital, lots of antibiotics later, I was released. I guess that doctor must have thought quote-unquote infected was just a suggestion, not a serious medical condition. Story 22. Not a doctor, but it took me 4 years to get a sleep disorder diagnosed, delayed sleep phase disorder. Started being unable to sleep early and wake on time, went through a million insomnia diagnoses and every management therapy possible. No improvement. I asked doctors if it could be a sleep disorder. Not possible, too rare, don't exist, your fault, and so on. I start checking out different sleep disorders. Based on my management therapies and symptoms list, I start ruling them out one by one. Researching your own murky disorder equals stupid idea, I knew. But hey, if not a single doctor has been willing to take your case further, what are you to do? After all, if you've had DSPD, you know that severe untreated DSPD can make it hard or impossible to study, work, or have a social life at all. Life is kinda at stake here. I came to the conclusion that it might be DSPD. Not trying to push anything. I've got a symptom history and a detailed sleep diary of over 24 months by this point. Dr. 1, 2, 3, 4, and 5 in the UK all said, you don't know what you're talking about, go to bed on time. Dr. 6 begrudgingly allowed me to see a sleep specialist in Oxford. The sleep specialist takes one look at my sleep history, symptom history, and survey results. Screams at the 5 previous doctors for being proud schmucks and not allowing me to make an appointment with her earlier. Diagnoses me with DSPD within a single month of testing. Alright, if you're enjoying the video and learning a thing or two from these stories, don't forget to hit that subscribe and like button for more videos just like this. Story 23. I had a patient come into one of my urgent care offices with a lump in her hand. She was in a car accident 7 years ago and said she has glass in her hand that was never removed and that she has lived with it for 7 years. She says she has seen multiple physicians, including a dermatologist, and they all told her that she was crazy. I admit, I thought she was crazy as well, but I had a student with me and I figured, oh well, let's open this lump up and see what we find. Normally, I would not do this, but this patient was essentially begging me with tears in her eyes since no one believed her. At worst, I figured I'd remove a cyst or lipoma. Sure enough, I make a small incision and squeeze and out pops a piece of glass. She just stared at me and I stared at her, closed her up. She wrote a super kind review on our website. We normally get crap reviews because we just don't hand out antibiotics for every cold that comes through the door. Story 24. I've had pneumonia several times and became ill again with the same symptoms. I knew it was pneumonia, but I can't get antibiotics without getting my wallet screwed, so I go see the doctor. I tell him I have pneumonia. He says, hold on, I'm the doctor here. He then tells me it's just a viral thing and to go home and get rest. A few days later, he calls me and says, we've reviewed your x-ray and you may want to get some antibiotics. I bet you're feeling pretty ill by now. Tells me I have pneumonia. I could hardly walk by that point. Story 25. I slipped on the ice last Friday the 13th and immediately knew I'd seriously hurt something. I heard a pop. When I tried to reach for my phone, I lifted my leg and realized something was very wrong with my foot. I kept telling everyone I injured my foot, but no one believed it was that bad. When they finally got my boot off, they were a little more serious about my injury, but it wasn't until the x-rays that they finally believed me. It was not even a little fun surgery. Even the oxycodone doesn't take the pain away enough to be comfortable. Story 26. I walked into an emergency room and informed the nurse that does the pre-check that I had a spontaneous pneumothorax, and she asked me who diagnosed you. I said myself. She then got all smart saying, well, since you're not a doctor, there's no way you can know that. A couple x-rays later, she walks into the room and says, looks like you got a pneumothorax. I told her I know. I told you that when I walked in. She said, well, and trailed off. Bet she felt dumb making me wait over an hour to be checked because I only had flu symptoms when I was really literally passing away. Story 27. Not me, but my sister. Years of issues that doctors kept writing off as neuropathy, fibro, kidney infections, etc. She keeps saying, I think it's Fabry's, keeps getting ignored. One doctor even laughed at her and said she needed to stop using Google and listen to the people with years of medical experience. Just last year, she set up an appointment with a geneticist, which isn't cheap, and she had to wait months to even get in. And turns out she's one of the lucky 1 in 100,000 to have the disease. Now she's being treated properly and has found an amazing support group and is able to much better handle the pain and complications that come with her disorder. Story 28. My mom went to the ER twice complaining of stomach pain. She told the doctor that all women in her family have had their gallbladder taken out. They did an ultrasound, but nothing looked inflamed, told her it was menstrual cramps and sent her off. She went to a different ER a few hours later and had to insist to the doctor it was her gallbladder. They decided to inspect further just to make her happy and get her to shut up. Turns out, in fact, it was her gallbladder. Something called strawberry gallbladder happens when too much cholesterol builds up in it, and it becomes irritated but doesn't grow in size, which means it's impossible to diagnose without a visual. Story 29. Not mine, but there was an episode of Dr. G, autopsy show, yeah, I'm weird, where this previously healthy woman passed away mysteriously in her late 20s right after contracting a mysterious illness that left her with sores all over her body. She went to the doctor and told them she got it from some dude whom she kissed at a bar and he just randomly decided to bite her lip. The doctor dismissed her, then she passed away. Anyway, Dr. G concluded that indeed she caught the disease from this guy and it was just a ridiculously bad case of herpes. Story 30. Not the doctor, but the patient. When I was 15, I was having abdominal pain, but lower. Around the same time, I had 2 periods and a yeast infection within 4 weeks, so I went to the gynecologist for the first time. My hormones were also so out of whack, I was totally emotionally unstable, so he patted me on the head, gave me a Prozac, and told me it was all part of being a teenager. A few months later, the pain was getting bad enough I was missing school and work because I literally could not force myself to stand. I did a bunch of research and the only thing that fit was endometriosis. I went to another gynecologist and found out I had a 5-centimeter endometriomal cyst that had caused my ovary to stretch dangerously close to its limit. This not only caused the pain but altered my hormone production, causing irregular periods and hormonal instability. It took 3 months to get rid of the cyst. We used medication instead of surgery because I was young enough my doctor didn't want to risk the loss of an ovary, and then 3 years to control the endometriosis. My doctor laughed when I told her the last guy prescribed me Prozac. Story 31. Obligatory, not a doctor, but in grad school one of my classmates came back from lunch looking kinda queasy. I asked him if he was feeling okay and he said he felt a bubbling sensation in his lower abdomen. I was concerned and after a quick Google search I told him it could be diverticulitis and that he should probably go to the hospital. He did and sure enough he was diagnosed with a severe case of diverticulitis requiring emergency surgery. He recovered well but was in the hospital for like a week on heavy pain meds. Story 32. Not a doctor but my grandfather was having stomach pains and went to the doctor and told him I have stomach cancer. The doctor laughed it off as an old crazy man, but a nurse insisted on making an x-ray. Turns out that he had cancer in his left side. The cancer didn't spread, and because it was discovered so early, they could easily remove it through surgery, and he's doing fine. Story 33. Not a doctor, but a patient. I had severe acne for years as a teen, which was easy to dismiss as just being a teenager. I had erratic periods, but I was told that was normal during teen years as well. Then I gained 30 kilograms in 2 years and began getting pains in the area above my hip. I did a bunch of research and found out 2 of my aunts and my mother have PCOS, so I go to my doctor and I tell her and I get all the tests done and an ultrasound on my ovaries. It comes back and I have excessive androgens and cysts on each ovary. She then says, but you don't have PCOS because you don't have excess hair. Well, I found another doctor who looked at all these results and within about 2 seconds said, yep, PCOS. I have since learned to manage my symptoms and I am doing much better, but screw that doctor. Story 34. Not a doctor, but at this point, I should be. In my 20s, I had a crazy medical condition that led to my spleen being removed and resulted in numerous enormous pulmonary embolisms. I was on anticoagulants for life until my hematologist passed away. I got a new hematologist who insisted I not be on anticoagulants. About a year later, my cardiac doctor did a test and told me I had PEs. He called my hematologist on speakerphone while I was in his office, and the hematologist insisted it was just a sensitive test. Shortly after I got this pain in my lower leg, I went to see the hematologist who sent me for a leg scan that turned out negative for clots. A few weeks went by and I was struggling to catch my breath. I went back to the hematologist who refused to do an MRI. A few days later, I went to see my regular doctor and I practically had to beg this guy to get the MRI. It turns out I had PEs in both lungs, one of which was quite large. My regular doctor sent me home with Xarelto and said I wouldn't need hospitalization. Over the weekend, I had severe chest pain, so I went to a walk-in clinic for some pain medication. They pulled up my MRI and sent me directly to the ER. The doctors at the hospital were absolutely shocked that I walked in. They admitted me for a week on a heparin drip and it's back on anticoagulants for life. And as if all that wasn't bad enough, the freaking hematologist had the guts to come into my hospital room at like 5 in the morning, and I woke up to him whispering in my ear, "I told you to go to the ER." You better believe I reported him, schmuck. Story 35. I'm not a doctor, but I do work in an allied field. My boyfriend's dad was quite overweight and took up a light exercise regime and started to watch what he ate more, but he rapidly lost a lot of weight. My boyfriend was talking about how great it was, but I thought it sounded like too much weight loss in a short time for the small changes he'd made. He then said his dad kept getting up at night thinking the heating was on because he was so sweaty and hot, but he went to his dietitian and they said it's just his body detoxing. I said, "That's not a thing. Tell him to go to the doctor as rapid weight loss and night sweats are some of the classic signs of TB and lymphoma." I said it might be nothing, but it could be something, and considering his mom had TB years ago, it could have been latent for all this time and suddenly become active. My boyfriend didn't listen to me. Months later, he broke down in tears and told me his dad had been diagnosed with a serious form of cancer. I thought this is strange, as it's typically a young man's illness, but I comforted him and asked why he didn't tell me his dad had surgery. He said he hadn't had surgery yet, he has had a test. You can't confirm certain types of cancer without a surgical biopsy. A specific test helps guide the decision, but it's not definitive. I reassured him they'd act fast and take it seriously. Turns out it wasn't cancer at all. It was actually TB affecting that area. Story 36. Not a doctor, but I heard this story while I was doing my MLS internship. Kid was 17 years old and wasn't starting to feel very well. So his mother goes online to see if she can figure out what it might be. She comes across a description of Addison disease, which isn't terribly common, even less so in a teenager. The mom notices one of the symptoms listed is darkened areas around internal tissue surfaces. The dad just happened to be a dentist and took a look inside his mouth and confirmed that his mouth was darker than normal. So the family brought him in and tests confirmed that it was Addison disease. Story 37. A little late, but this is the case of me diagnosing myself. While not directly relatable, I am a nurse, although this was happening when I was still a student. After fainting at work, I started paying attention to my heart rate and I found I was walking around with an average heart rate of about 160 BPM. I also felt dizzy most times when standing and my resting heart rate was normal, about 80 BPM. I brought it up with my general practitioner, questioning a diagnosis of something called postural orthostatic tachycardia syndrome, POTS, that I found while Googling around. It also come up in my studies as a newish diagnosis that wasn't well understood. He brushed me off, saying I needed to hydrate more. A few months later, I got sick with the flu and couldn't get my resting heart rate below 130 BPM, and it jumped to greater than 200 BPM just standing up. I went to the hospital and had a number of tests done, and sure enough, the internal medicine doctor walked in and asked if I had ever heard of POTS. My general practitioner is now fascinated with my diagnosis and asks me about my treatment, which is managed by a cardiologist whenever I see him. Story 38. As a speech therapist, I diagnosed via Google my patient with esophageal achalasia, which is a rare condition. As a speech therapist, my knowledge doesn't really extend as far as the esophagus, but I used to get a fair amount of referrals that were related to that rather than swallowing. Most patients just had some dysmotility. I'd never come across anything this severe before. This poor man was basically regurgitating everything that he ate or drank, was losing significant amounts of body weight very rapidly, and his doctor didn't know what to do with him. I referred him for a barium swallow and insisted on attending. Before the procedure started, the consultant told me I was wasting his time with this patient, who clearly had a swallowing problem, not an esophageal problem, and basically I needed to do my job properly. I said we'd wait, see what happened. Anyway, the barium swallow then clearly showed only the tiniest trickle passing into the patient's stomach, and he had to run off to the bathroom to regurgitate all the barium fluid he had just taken. In fact, it was worse under X-ray than even I had expected. He was diagnosed with achalasia, as I'd guessed, and he had to have a PEG tube inserted so he could meet his nutrition and hydration needs. Unfortunately, they weren't able to improve his condition, but he probably would have passed away of dehydration or starvation had I not got him to do that procedure. The consultant didn't apologize or admit he was wrong, of course. Story 39. Okay, so I was a person self-diagnosing, and even I was unsettled by doing that. In my case, I've known I've had bipolar disorder since I was 13, but felt like an a-hole assuming that since, hey, I was a moody teen. My mom took me to a therapist who didn't believe much in disorders and pills, and I, inconveniently, evened out for a bit. By the time I was 17, I wasn't doing well. I went through some extreme highs and lows, months of racing thoughts, intense anxiety, sleepless nights, and overwhelming emotional shifts. I struggled to function most of the time. In early 2013, I forced my mom to take me to a doctor after showing her my arm and explaining my head is some sort of hellscape. I tell the psychologist that I think I have a mood disorder and rattle off my evidence. By the end, she looks me straight in the eyes and says, most of the time when someone comes in saying they have a mood disorder, I already assume they are over-exaggerating, but you are not that case. I swiftly was diagnosed with bipolar 1 disorder that day and put on medication. I'd never been more vindicated, relieved, and terrified in my entire life, but I'm okay now and I've been slowly getting better ever since. I don't recommend self-diagnosis, but I'm happy it helped save my crazy head. Story 40. Not a doctor, but I recently diagnosed myself, which likely saved me from a slow and serious health decline. I'd been to 8 doctors in 2 years, plenty of tests, brain MRIs, spinal MRIs, and CAT scans. They kept finding nothing. I presented with tachycardia, 200 BPM from taking a shower, memory loss, I'd forget who I was, tremors, weakness, unable to put a straw through a cup, fatigue, sleeping 20 hours a day, nausea, vertigo, I'd collapse, shortness of breath, headaches, random pains, and severe throat spasms. My doctor's diagnosis? A repressed memory that I didn't know I had. So I started taking over my health. I'm a nursing student and my mom is a nurse, so we started to do our own research. Very long story short, I have a severe B12 deficiency, which is degenerating the nerves in my brain and all over my body. I insisted on B12 injections from my doctor and he complied, I think just to humor me, and that was it. 1 injection a week and now I feel absolutely incredible. Story 41. Had a feeling I had appendicitis when I was 14, was at home for around 2-3 days with crippling stomach pain. Certain members of my family didn't want me to go due to conspiracy, that the NHS do unnecessary operations and they were thinking I've just got a stomach pain. Went to my local GP, he didn't think I had appendicitis but advised me to go to A&E to get checked out in case he's wrong. After I gave a sample and explained my symptoms, the doctors concluded it was appendicitis, and I came in just in time as things were about to get much worse. I had surgery the next day and was kept under watch for 5 days. Well, at least now he knows who to trust for medical advice, his own gut, literally. Story 42. Not a doctor, but I diagnosed myself with hyperthyroidism. The GP told me there's no way I have hypo because you're young and skinny. Apparently, my inability to think, drive, run my business, cook, or have a simple conversation and many other symptoms was because I was quote-unquote stressed. I asked for a thyroid panel 3 times. In the end, I went and did one privately, took the results to my GP, and he put me on meds straight away. Meds helped a little, but weren't back to my normal self, so I researched and found a better medication. Story 43. Not a doctor, but 4 years ago I had a car accident on a Friday night and ended up in the ICU with various injuries and an undiagnosed extreme pain in my stomach. Doctors couldn't see anything on scans, so I remained in the ICU over the weekend waiting for arm surgery. On Monday, I still had extreme stomach pain. I kept telling the doctor, but he insisted the scans were clear. My family says I turned gray throughout the day. At 5 p.m. on Monday, I told my nurse I needed my stomach looked at or else I was going to pass away. Finally, my doctor decided to do an exploratory surgery. I woke up 10 days later and it turned out that both my large and small intestines had sustained serious internal damage, and I had an infection throughout my entire abdomen. I underwent multiple surgeries, had portions of my intestines removed, and needed a medical device to assist with digestion and recovery. The doctor told me that if I hadn't pushed for that surgery, I would have passed away that night. Trust your gut. Story 44. Not a doctor, but a patient. Over the summer, I got really sick suddenly. I was retching, high fever, couldn't walk any further from my room to the bathroom without being out of breath. Mother wanted to take me to the doctor, but our insurance wanted us to try this new phone-a-doctor service. Without seeing me in person, the doctor diagnosed me with the flu despite it being the middle of July. I got on some meds for it, but with little improvement, my mother insisted we go to the hospital. I had extremely bad pneumonia as I'd gone without treating it for 3 to 4 weeks. Ended up having to spend a couple of days at the hospital completely bedridden. By the time we got there, I couldn't even get inside the emergency room without gasping for air. Story 45. Patient here. Went to the hospital after hurting my finger playing football. Doc did some test where I had to move my hurt finger to touch my thumb. Apparently, that was enough for him to say, "It's not injured, go home." I've had injured bones before, so I knew he was wrong. I told him I wanted the x-ray anyway. He said it would be a 2-hour wait and a waste of time. I insisted much to his annoyance. Finger was indeed injured. Story 46. I used to work in a university ER as a medical scribe. One of my physicians would talk about this patient that came in with a headache and stated that felt like he had a clot right here and pointed to the side of his head. When the doctor asked why he felt that way, the patient said, "I don't know, man, that's just the way I feel." He eventually ordered a rule-out head CT for the PT's symptoms, and lo and behold, that mother trucker had a small clot in that region of his brain. He said it was one of the most bizarre things he'd ever seen, and it was a level 1 trauma center too. Story 47. Hemiplegic migraine. Had migraines for a long time, but the symptomology wasn't quite the same. Severe pain in face, neck, shoulder, tingling in the face and arm, numbness in hand. Tried to go to urgent care because, well, it's cheaper. Nope, they wouldn't see me. Got sent to the ER because the symptoms are too similar to a heart attack. ER gave me Benadryl and charged me a ton for it. Self-diagnosed an injured labrum in my shoulder and BPD after years of them trying to tell me I had something else, anything else. Story 48. Was having seizures. Everybody thought I was being a schmuck and faking them. I also had migraines. In addition, my vision had gone double for quite a bit. I insisted that I needed to talk to a doctor and that something was off in my head, and that these were not separate acts or medical conditions. Finally, I had a seizure at the national anthem of a Little League game on the field in front of a crowd, which a little shy me would never pretend to do. Finally was taken to the hospital. I had an MRI and was diagnosed with a brain tumor 8 years later and no signs of it returning, crossing fingers. And if any of these stories got to you, here's more for you. YouTube thinks you're gonna love this. I'll catch you in that video.